Pregnancy Week 16. Congratulations! You have reached 16 weeks, which marks the completion of 4 months of your pregnancy. The second trimester is typically the most comfortable and enjoyable phase of pregnancy. You may experience a boost in energy as many of your uncomfortable symptoms have eased. You might also notice a pregnancy glow during this time. Your baby is growing rapidly and is about to undergo another growth spurt. You may even have the opportunity to hear your baby's heartbeat for the first time, which is an exciting experience for most parents to be. Week 16 Pregnancy Ultrasound. At 16 weeks of pregnancy, an ultrasound can provide detailed information about the baby's growth and development. If you missed your earlier ultrasound, have experienced health challenges, or if your doctor wants to monitor your growing baby closely, they might recommend a 16-week ultrasound. This scan can help check the baby's progress, monitor health conditions, and detect potential complications such as genetic issues or neural tube defects. If multiples are suspected, an additional scan can help confirm this. Your healthcare provider will also perform a urine test to detect any signs of gestational diabetes and preeclampsia. You may also be offered a multiple marker test, a second trimester screening test that measures AFP levels, HCG, and estriol in the mother's blood. This test can help identify the risk of neural tube defects and chromosomal abnormalities such as Down syndrome. Week 16 Size of the baby. At 16 weeks pregnant, the baby is approximately the size of an avocado. It measures between 4.6 to 5.5 inches long and weighs 2.5 to 3.5 ounces. Week 16 Baby's development. By week 16 of pregnancy, your baby's skin thickens, and hair follicles form on the scalp, determining their hair growth for life. At this stage, your baby's heart is pumping 25 quarts of blood each day. This will increase as your little one continues to develop. Their eyes are making small side-to-side movements, and they can perceive light. Tiny bones form in their ears, enabling them to listen to your voice. Their muscles and bones are taking shape, toenails are appearing, and their legs are developing. The liver and pancreas are beginning to function, and more lung tissue forms. Their joints are working, and they can even wriggle their tiny fingers and toes. The umbilical cord is fully formed, with 2 arteries and 1 vein. They can flex their muscles and limbs and make expressions with their face, although they can't control them just yet. The backbone and tiny muscles in your baby's back are gaining strength, allowing them to straighten their head and neck even more. Your baby can hold their head up, and the development of facial muscles allows for various expressions, such as squinting and frowning. Week 16 Pregnancy Belly. Around 16 weeks into your pregnancy, you might notice your baby bump. However, it's important to note that every pregnancy is different and there's no one-size-fits-all for baby bumps. Some women may not show up at 16 weeks, while others may have a more noticeable bump. Your belly size at this stage can be due to an expanding uterus, bloating, excess fluid, and your growing baby taking up space. This can be influenced by whether it's your first pregnancy or not. As your baby grows, you'll feel movements in your belly. Initially, these movements may feel like gas or muscle twitches, but as your baby gets bigger and stronger, they'll become more obvious. If you're pregnant with twins, you won't feel kicks any earlier than a mom-to-be carrying a single baby, but you may feel more kicking sensations over time. However, feeling your baby move also comes with some challenges, such as crowding of the lungs, which can make it difficult to breathe at times. It's important to remember not to compare your bump to others and not to worry too much about the size of your belly. Talk to your doctor for reassurance if you have any concerns or questions. Week 16 Pregnancy Body Changes. At 16 weeks of pregnancy, significant changes occur in your body. The uterus and placenta continue to grow, leading to weight gain. Amniotic fluid also increases to protect the baby. Some women may experience a pregnancy glow due to increased blood circulation and hormone production. Increased blood volume and pregnancy hormones may cause discomfort, such as varicose veins and leg cramps. These can be relieved through exercise and stretching. It's recommended to sleep on your left side with a pillow between your knees and supporting your abdomen to improve circulation to the fetus and uterus. Hormonal changes can also lead to backache, for which maintaining proper posture and performing daily exercises are recommended. If you are pregnant with twins, it's important to inform your doctor about any symptoms, as twin pregnancies are considered higher risk. Week 16 pregnancy symptoms. Round ligament pain. You may experience sharp, shooting pains in the lower abdomen or groin area due to the stretching of the ligaments as your womb expands to accommodate your growing baby. Nasal congestion. Some women may experience a stuffy or runny nose and nosebleeds during pregnancy due to increased blood flow to the mucous membranes and hormonal changes. Dry, itchy, sensitive eyes. Hormonal changes during pregnancy can lead to dry, itchy, and sensitive eyes. Vaginal discharge. Increased vaginal discharge, known as leukorrhea, is common during pregnancy due to hormonal changes and increased blood flow to the pelvic area. Gas and bloating. Hormonal changes and the pressure of the growing uterus on the digestive organs can lead to increased gas and bloating. Forgetfulness. Pregnancy brain, or forgetfulness and difficulty concentrating, is a common experience for many expectant mothers. Heightened sense of smell. Some women find that their sense of smell becomes more sensitive during pregnancy, which can lead to aversions to certain odors. Feeling hot. Increased blood flow and metabolic changes can lead to feeling warmer than usual. Swollen and bleeding gums. Pregnancy hormones can affect the gums, leading to swelling, tenderness, and in some cases, bleeding. Weird pregnancy cravings. Some expectant mothers experience unusual food cravings, which can vary widely from person to person. Week 16 pregnancy checklist. Schedule your mid-pregnancy ultrasound with your healthcare provider to monitor the growth and development of your baby. Research and discuss any second trimester prenatal tests that may be recommended based on your medical history and individual needs with your healthcare provider. Avoid engaging in unsafe activities such as scuba diving, contact sports, snowboarding, downhill skiing, riding four-wheelers, horseback riding, and some amusement park rides. Schedule any necessary dental work and have a regular checkup during pregnancy for good oral health. Plan a relaxing baby moon trip with your partner and consult your healthcare provider before traveling at 16 weeks of pregnancy. Start baby-proofing your home while you still have the energy. This may include securing furniture, covering electrical outlets, and removing potential hazards. Take time to talk to your baby, as research suggests that babies can recognize familiar voices, including that of their parents, while still in the womb. Research childcare options and costs after your baby is born. Being prepared will help ease the transition into parenthood. Week 16 pregnancy tips. To best support your breasts, updating your bra drawer and investing in high-quality maternity or nursing bras is recommended. During pregnancy, finding a chair with good support is important to avoid discomfort and back pain. To prevent acne breakouts, following a healthy skincare routine and avoiding using harsh chemicals is best. Breast growth or no growth is normal in pregnancy. There's no need to worry about it. Unless you have a peanut allergy, it's suggested not to avoid peanuts as they are a great source of protein and other nutrients. To moisten your dry nose and relieve congestion, it's recommended to use a humidifier. As part of a healthy diet, especially if you are a vegetarian or vegan, it's encouraged to embrace plant proteins. To manage back pain during pregnancy, you can try exercises, stretches, and other techniques recommended by your healthcare provider. To get essential vitamins and minerals, it's recommended to go for greens and eat plenty of leafy vegetables. For more videos like this, please like, share, and subscribe.